I think if back pain is associated with any other symptoms, such as chills, fevers, bowel bladder changes, any other constitutional symptoms, the child sneezes and the back hurts, the mom goes over the little bump in the car and the back hurts. These are stuff we should take seriously because that would sort of point us more towards structures that are destroying the architecture of the bone and causing the child to have pain. So any sort of associated constitutional symptoms and back pain requires immediate medical attention. The sort of episodic back pain that the child sits there and is smiling and says, oh, my back is really killing me, but then, you know, he's jumping out, playing with his friends, doing the video game. That would probably be more of a positional back pain, and you could kind of modify how he sits to make sure he doesn't have too much books in the backpack, weigh the backpack, how he stands and carries it. If the backpack weighs about more than 15% of your body weight, there's been some clear data that shows that could be sort of causing you to lean forward, stand in an abnormal position, and that could potentially cause excessive strain on the musculature in the lumbar spine or thoracic spine and cause you to have back pain. Another thing I think that's going on in school-age children is the development of video games and computer-based stuff, that children are right now sitting behind some of these games, and it wasn't just Pac-Man that would be done in 30 seconds. Now, you know, there's stories that just sit there and they get so involved in it, so they sit in a certain position, most likely hunched over on the ground, kind of wherever, you know, you could put the TV and the PlayStation for them, and they sit in that position for long periods of time. And that's sort of an awkward sitting position, and that most likely contributes to some of this higher incidence of back pain that we're seeing in children. And if they last more than about 6 weeks, and you've done your sort of modification of sort of the activities of daily living, and they still are complaining about pain, then I would seek sort of an evaluation by a doctor.